48,000 teachers and school staff have been vaccinated on the very first day of their vaccination program. The health department is aiming to vaccinate more than 580,000 educators in the next 2 weeks, they tell us. However, ECD, or early childhood development, that sector has not been included in the drive. Let's try and find out possibly why that is, and some advice from family practitioner Dr. Karen van der Merwe. Dr. Merwe, good morning to you. So vaccinated teachers is obviously very good news. We'll talk about ECD in a moment, Doctor, if we could. Let me start with this. Even though teachers have been vaccinated, and that's still ongoing, I imagine they still need to be incredibly careful, don't they?
Good morning. Thanks for having me. Absolutely. So we know that vaccination does decrease your chance of getting COVID, and especially severe COVID, but you can still catch COVID, and it takes a while for the vaccine to take its effect. The teachers are getting the J&J vaccine, so it will take at least 3 weeks for the vaccine to come into effect. And we all still have to be extremely careful. Mask wearing and ventilation being the two key issues in schools.
As a family practitioner, Doctor, I can't imagine I'm the first person to ask you this. I'm sure your patients have asked this with younger children and kids still in school. Why do you think it would have been better, is what I'm asking. Do you think it would have been better to vaccinate school-going children instead of the teachers, or do you think this has been done the right way around? Because I can imagine parents going, but why must I send my kid to school if they haven't been vaccinated, but the teacher has? I can't be the first person to ask that question.
So, I mean, children are always an emotive issue. People are always very worried about children and how they're going to be affected by diseases. But fortunately, with COVID, children are not severely affected by COVID. We do see children with COVID. They normally have a cold and they get over it. So children don't need to be targeted for vaccines. Teachers are at a higher risk because they're adults. And I think one of the main reasons to vaccinate teachers is just to keep the schools open. And because they're obviously in contact with lots and lots of people. The other thing to mention is that the younger the child, the less likely the child is to get COVID, and that the vaccines haven't actually been approved for children under the age of 12. So that if we were to vaccinate children, we'd only be vaccinating them from 12 years old. And I feel we've got to keep those vaccines for the high-risk people at this point. Children do not get severe COVID.
Let's talk about ECD, early childhood development. It was odd when the announcement came out that teachers and educating staff are going to get the jab, only then to realize later, not early childhood development. Could you maybe put forward an idea as to why that would be? I mean, it is the same sector, isn't it?
Yeah, I did find that a little bit odd. I can only think that because older children are much better at transmitting the disease. The teens are the ones that can transmit the disease. Children below the age of 12 are actually not good at transmitting COVID. If you look at household studies where they've actually seen who the index case is in households, it's quite unlikely for it to be children under the age of 12. Children can catch it from their households, but they don't tend to give COVID to their households. And I can only think that because the younger the child, the less likely they are to transmit COVID, that they've excluded the ECD teachers. But I actually think they should probably have included them.
Yeah, I would agree as well. It didn't make much sense to me. Dr. van der Merwe, before I say goodbye to you, as a family practitioner, I'm curious. We're now into winter season, aren't we? And let's talk a little bit about some of the patients. Are people still mixing up getting a cold and a flu and panicking and going straight to COVID-19? They think everything, every sniffle, every cough is now COVID-19. How do we tell the difference?
You can't tell the difference. And it's very good to think that every cough and cold and sniffle may be COVID-19. You need to treat a cough, a cold, or a sniffle as though it could be COVID-19. I have many patients coming to me, no, it's just a cold, it's just my seasonal allergies, it's just my usual sinus, and it turns out being COVID. COVID can be extremely mild. So rather, if your children are sick, if they have a sniffle, keep them at home. Don't send them to school. Same goes for your workplace. And rather go and check with your doctor. What you may be able to afford to have a swab and find out if it is COVID or not. But in the time we're living in this massive wave that we're having, we need to be very vigilant with any symptoms.
Doctor, I appreciate your time in speaking to us this morning, and all the best with you and all the patients that are going to come see you, of course, for the annual flu jabs, and now, of course, the COVID-19 jab, if they qualify for that. Family practitioner, Dr. Karen van der Merwe, joining us, part of the Gauteng General Practitioners Collaboration. Good advice as well. Treat it like it's COVID-19. Don't assume you don't have it if you're coughing and sneezing, but, of course, remember masks all the time.